Diseases are seen every day, and I've seen a few of them personally. My grandma and a little boy that I know both have been battling cancer. I have a grandma that had diabetes and actually beat it and got rid of it, and my great-grandma also had a severe case of Alzheimer's. And I brought in the cancer ribbon and the Alzheimer's ribbon and also the diabetes ribbon. Everyone is aware of the diseases, but having a greater knowledge of the severity of each disease will help you understand them a little bit more. And cancer, Alzheimer's, and diabetes all have similar things in common. First of all, they're all chronic and endocrine metabolic diseases, and they all have stages of severity. Cancer has 4 different stages of severity. The first one is stage 0, which, as you can tell, is the littlest of all of them, and it has not moved from the original spot and is easily curable with surgery, so they can get rid of it if they get it close or soon enough. Stage 1 is the tumor is small and it's grown into the tissue a little bit more, and it's often called early stage cancer. Stage 2 and 3 both have around the same size of tumor, and they have grown deeper into the tissue and the lymph nodes, and then they have also gotten into other parts of the body. And stage 4 has the biggest, and it also has gone to different parts of the body. So it can, the diagram you see is colon cancer, but it also shows the different sizes of them. Alzheimer's has 7 stages of severity, and the first one is no impairment, which means that you can't really see the stages. You can't really see the disease yet anymore. There's no symptoms of it. They're still functioning just fine. Stage 2 is very mild cognitive decline, which they're having memory lapses. They don't remember what they were supposed to do that day. Stage 3 is the mild cognitive decline, and you can see some symptoms. So if you put them in an interview with the doctor could actually see that they actually have symptoms. And during the stage, during the stage you can see more of the trouble of them misplacing objects, different things like that. And stage 4 is moderate cognitive decline, and this is, you can see major symptoms. Like if you put them in a room with a doctor and they interviewed them, you could tell. And they're forgetting recent events, they're having trouble doing simple math problems, and they're forgetting their personal history. So they don't know where they came from, they don't know who their parents are. And stage 5, you can see it from day-to-day, daily activities. During this, they can't recall their address, they don't know where they live, so they need help with that. They have confusion on what season it is, where they actually are. Say they're at their kid's house and they don't know where they are. But they're still able to eat and go to the bathroom by themselves. Stage 6, you can clearly see it, and it's the lost awareness of recent experiences, so they can't tell what they did 5 minutes ago, stuff like that. And stage 7 it's the final stage of the disease, and it's the most severe. They can't move very much, they need help getting dressed, they need help going to the bathroom, they need help brushing their teeth, and they even need help eating. And when you ask them who their kids are, they have no idea. This one actually shows the different brain, and the purple shows which brain parts shut down first, and different things like that. And then my last is diabetes. And there's 5 stages of diabetes. The first is compensation, and this means that the B cell mass increases, which makes the insulin secretion go up, so they need more help getting the sugars down and having their blood pressure right. The second is stable adaptation, and it's an important step for the B cell because it changes, and they lose a significant amount of the B cells. And the third stage is unstable early decomposition. The glucose levels in their blood rises, so they need even more insulin, so the secretion becomes greater. The fourth stage is stable decompensation. In this stage, most people have enough insulin in their bodies yet, and they've secreted enough insulin that they can stay in this stage for their entire lives. So they don't go past stage 4. But some people actually do get past stage 4, and stage 5 is severe decompensation. And there's such a significant loss of B cells that they need insulin constantly going into their body, so that would have an insulin pump, or they would have insulin shots whenever they eat to make sure their insulin is correct. And this is when they're in ketonic in the disease. And in conclusion, we have a lot of diseases that are mentioned in here, and if everybody knows the diseases and how severe they've gotten, there's more of a chance that they can help and give more sympathy to them. And there's also ways that you can cure some of these diseases. In diabetes, you can, if it's type 2 diabetes, it's normally created by having overweight or obesity. And if you cut down your obesity or your weight, you can get rid of the diabetes.